Do you hear the word still? Do you hear the word still? It is not just a word, it is a disease. Can you believe? Yes, Still's disease. Myself Sumar, I am the student of occupational therapy. Adult onset still disease or simply still disease is a systemic inflammatory disease. It is characterized by mainly three characteristics. First, persistence, high spiking fever. What is persistence? Continuous. What is spiking? The temperature increases more and the fever is have. So the person have persistent spiking fever and the person have joint pain and some persons have joint inflammation also. The person have rashes, pumpy rashes, it may be in salmon color, orange mixed color, so salmon color. So these three characteristics are have in still disease. What are all? First, persistent high spiking fever, joint pain or joint inflammation, then rashes, pumpy rashes. It may be in salmon color. Sadly, this disease is idiopathic. What is idiopathic? There is no known cause for this disease. The precise cause for this disease is still unknown. That is idiopathic. And also, there is no known preventive measure for this still disease and no known risk factors for this still disease. So that is why it is called still disease. Still no is known. So for whom this disease is coming is not known. So the risk category don't know, and how to prevent the still disease is not known, and how it is caused is still not known, and how to treat is still not known. Though some theory says it is created by a microbe with the infection, and some theory says it is an autoimmune disorder, and some theory says it is a viral mutation in gene, and still now there is no known cause accurately. Still, it's not known cause, but pathophysiology is known. There is an involvement of interleukin 1 beta. So we have to block the interleukin 1 beta. So the drugs against this interleukin 1 beta are developing. So anti 1 beta is developing. So these drugs can reduce the symptoms of the still disease. What is the relation between the JIA and still disease? JIA means juvenile idiopathic arthritis. Who are all juvenile? The children under age 60 are all known as juvenile. Idiopathic, unknown cause. So the juvenile going to be get arthritis with unknown cause. So juvenile idiopathic arthritis, and we already said still disease is also known as adult onset still disease. There is a types in JIA, juvenile idiopathic arthritis. What are all the types? Oligoarticular and polyarticular. Oligoarticular means there is an involvement of one joint. So one joint going to be get arthritis. In polyarticular, there are more than one joints are involved in arthritis. Previously, this juvenile idiopathic arthritis is known as juvenile rheumatoid arthritis. I believe you are all known what is rheumatoid. So rheumatoid arthritis is the autoimmune disorder. So rheumatoid factor is present in our blood and it affects our own joint synovial region. So it causes the joint inflammation and joint pain, and deformities are also comes due to the rheumatoid arthritis. Let's come into the point. Still disease is the one type of juvenile idiopathic arthritis. So this form is this form. What are all the signs and symptoms? Articular sign, which means the involvement of joint. So after some fever and some rashes, the joint pain occurs. So there is a inflammation in the joint can be visible, and there is a severe pain in joint, and it may be involvement of one joint or it may be involvement of more than one joint. So it is also known as poly. Extra-articular signs and symptoms, which means there is no involvement of joint. In this category, many more symptoms are comes under the still disease. First, extreme fatigue, poor appetite, the person feel less hunger only, and weight loss. Eventually, the person having poor appetite means they going to be the lose their weight. So then nausea is present. The sensation of vomiting is also present to the person with still disease. Other than these, lymphadenopathy, splenomegaly, hepatomegaly, soreness in throat, sore throat. These are all present. Some persons have underlying complications like pericarditis, pleuritis. Pericarditis is the inflammation of the pericardium. What is pericardium? The covering of the heart is known as pericardium, and covering of the lung is called pleura. So pleuritis, pericarditis, and pleural effusion means accumulation of abdominal fluid, and then pericardial effusion, the accumulation of useless fluid in the pleura. So these are all underlying complications. So I already said in the first starting, I said that is high persistent high fever and rashes, pumpy rashes. These are all also the sign of the still disease. Beyond these are also present in the still disease. The person with still disease may have elevated WBC, which means WBC count is increased, and depressed RBC count is reduced, which means it leads to anemia also. And these persons have erythrocyte sedimentation rate elevated and C creatine protein also elevated. So ESR elevated and CR is also elevated to these persons. However, rheumatoid factors and anti-nuclear antibodies are also absent, which means these tests are negative for this still disease person. Now, how we are treating the still disease? We are reducing the inflammation. So it is not a cure. We can treat symptomatically. So we have to reduce the symptoms. First, there is a inflammation in the joints. So we have to use anti-inflammatory drugs. So it may steroid or non-steroid. So we have to use to reduce the inflammation of the joints and reduce the joint pain. We have used analgesics. So I already said there is an involvement of interleukin 1. So we have to use the drugs that block the action of the interleukin 1. I want to say the truth, there is no cure for the still disease. So some persons with mild symptoms recovered normally. So some persons having symptoms and taken treatment, and that symptom never ever come back in their life. So they are permanently cured. So but it's not a cure, but their symptoms are not shown again. So for some persons they treated and the symptoms are shown after some times. So these are all also happening. These are all also happening in severe cases like hepatic failure and respiratory problems. The persons may lead to death also. So still disease is still disease only. So I want your support. Please subscribe. I know this video may be helpful for you and it gives you information. Thanks for watching.